What was some of the things that brought you into therapy to begin with?
I have had severe dizziness and migraines since about the fall of 2011, and I have a disability where my right side is slow and spastic, and it causes my entire right side to be affected. And when I'm off balance on a good day, and you throw weather or heat or light up against that, then I'm grasping for a wall to hold on to. I'm in bed. This winter was really rough on me. 2 separate weeks that I was in bed. I literally could not even get up to go to the bathroom. And it's amazing to me. Nobody can understand where the dizziness is coming from. No medicine has worked, no Vyepti, no Botox, no SPG blocks, nothing worked. And I went to see a neurologist in Louisville whose child was at UK, young adult is at UK, and she was just starting to get migraines and dizziness, and she looked into Neuro Visual Performance Institute and said that it could be a fit for me. And for the first time in a long time, I had hope that I could start getting better, and came to see Dr. Gravy and learned what he was all about, and the fact that there is no medicine involved. Can't tell you how many medicines that people over the years have tried to give me. And he's like, I think we can work with it, and gave me some tips on how to get my balance a little better. And it's just been an amazing journey, and I'm not even halfway through yet, I know, but I can already see a big difference. And to just be able to live again, that is a big thing.
All right, so you are about almost halfway through therapy. What are some things that have been going on at home?
Well, for one thing, in the past, I would have a pretty good day, so then I would try to do laundry, or I would try to wash dishes, or go pick up a grocery order. But then the next day, I would be so tired and worn out that I would have to be in bed all day. And I have noticed now, and just since I started treatment here, that I can do those things and I still have another good day the next day. I may be a little bit tired, but still am able to function multiple days in a row, which is a very big thing for me.
And what are some things that you weren't able to do in the past that you are able to do now?
Usually if I'm in a car, I get real dizzy within like 20 minutes of getting in the car. And that includes driving or being a passenger. And I have to take a dizzy pill, just like over-the-counter Dramamine or whatever. But this past week, I was able to drive myself 2.5 hours home to West Virginia. I was working at my mom's house, getting a yard sale and stuff ready. So I was busy on a Thursday, a Friday, and a Saturday. And then I actually ended up driving myself back home Saturday evening. So I didn't have a down day in that, which is really good. And I really didn't have a lot of sleep due to the things surrounding all that. So for me, even just to be able to drive a car around town is one thing, but to be able to drive the 2.5 hours home and to have that freedom and then not have a down day. I mean, that I was functioning every single day. When I did come home Saturday evening, then Sunday was a really rough day, but that's okay. That's to be expected. It used to be every other day was like that, or more was going to be a down day, and now it's not. And I know it has to be because of therapy. I really am just amazed at how therapy has worked. I really am.
And previously you weren't able to drive. How long has it been since you've been able to drive?
Well, I can drive around town as long as I'm not dizzy. And actually it's been over a year since I've gotten it to drive home. And I'm like floored. My husband's like, you're gonna be worn out. You're not gonna be able to do it. And I'm like, yes, I am. I'm gonna do it because I've had the therapy, and the therapy is working, and I'm gonna prove it. He's just amazed that it's working as well as it is. I mean, I can see a difference, but my husband can too, and my son, even if they have to kind of make fun of me a little bit as I'm working on it. But yes, it's been really great therapy.
Yeah, and even you went on a big road trip.
Yes, did. In June, we went out west, and we basically drove a vehicle around, and I was in the back seat, which is very surprising to me too, because normally in the back seat, I'm very, very nauseous. But because my kid is over 6 feet tall, I let him be in the front seat. And some of the mornings I kind of had to rest for a little bit while we were driving. But then once we got to where we needed to be, I was able to get out and actually take part in the activities. Not really a lot of activities, but if we were looking at the animals or we were going into a museum or whatever, I was able to function. I did have a down day, but it was only a half a day. And then I got to go and be like 50,000 feet, I think is what it ended up. No, 12,000 feet? Not 50,000 feet. It was 50 degrees. 12,000 feet. And I've only been like 12 weeks in therapy, and I can see such a big difference.
And the last question, what is some advice that you would give to either future patients or current patients that are here right now that are experiencing things?
I know it's hard. Believe me, there are days that the last few days have been harder for me, and I have not done my therapy at home, and I'm bad for that. I'm gonna have to push myself, and it is hard. But if you keep going and that you keep trying, you're going to see results. Everybody here is so encouraging, and they want you to get better just as much as you do. And I just want anybody, they can do it. If I can do it, anybody can do it. And I think that's awesome. Whether you're a child of 5 or 6, or you're an older gentleman of 70 or 80. This is a wonderful place. The Neuro Visual Performance Institute is amazing, and I would recommend them to anybody.